Hi everyone, I am Dr.Saritha Prem, Director of Pharmacy Surabhi Ayurvedic Hospital. So here I am with a new topic today. So we all know that skin is one of the largest sense organ in our body. So if any lesions appear on skin, it really makes us more mentally disturbed. So understanding the skin disease is very important. So how to differentiate each conditions, its types, its appearance, symptoms and everything is very important. So today we are discussing about I am going to give you a detail about eczema. So eczema is a common condition. We know many people are suffering from this condition, skin condition. So the word eczema itself means that breaks over or boils over. So when any allergens are entering into our skin, so definitely the skin reacts to defend it. So it definitely try to boils over. So eczema means the patchy skin lesion, skin becomes inflamed. That is inflammation of the skin. Merely we can call it as dermatitis also. So here there will be more itching, reddishness, sometimes more thickness, patchy lesion. And even sometimes due to while itching we can see slight oozing of fluids from these lesions. So this is a typically we can call it as eczema. So what are the causes of eczema? There are more causes for eczema, especially we can see that if there is any familial history of allergy, hay fever or any bronchial asthma, so typically many are prone to get this eczematic condition in that family. And some sort of food items, especially we know seafoods, majority of people love to take prawns, squid, crab and shellfishes. So these type of fishes have a triggering factor that it increases the allergens. So this type of seafoods, and even some sort of allergens like if they have any contact with certain chemicals, acids, especially those who are working in construction field, or when they have a contact with cement and all, no, they used to get more allergic rashes on their hands and leg. So these are some of the common causes. And other causes we can say any type of drug. So intake of certain steroids or certain antibiotics can create an allergic reaction to the skin. And even usage of certain cosmetics, and especially the exposure to dust and intake of alcohol, usage of tobacco, all are some of the factors that triggers this condition. And when we come to the symptoms of eczema, the common symptom which we can see in eczema is more itching sensation. So that is the skin will be more dry and patchy. So there the patient will be exhibiting more itching sensation, and sometimes the skin appears reddish, and sometimes there will be a slight oozing from the skin and it will be inflamed. These are the common symptoms we can see in eczema. And next, the very important part is how to differentiate with each and different types of eczema. So when we see in clinic, we should know what are the types of eczema in order to differentiate it. The first and common type is atopic dermatitis. Here this is a common type of eczema which we can see in children, especially in children below 5 years. It's very common. So here the rashes will be developed more, reddish itchy rashes will be developed on lower limb, hands, chest and face and all. So it will be more itchy also. It's very common in children. So here also can be due to familial history can be one of the reason, or any type of allergic contact means exposure. If the allergic factors in allergens are a high level in the bloodstream also, it can happen. And the next one is contact dermatitis, that is mainly in that first category is irritant contact dermatitis. So irritant contact dermatitis, here the lesions appear due to the excess contact of chemicals or any acids like that. So when the person is having contact with these acids and chemicals, the rashes will develop on the hands and the area where he is having more contact. It is irritant contact dermatitis. The other one is allergic dermatitis, a very common condition, another condition even we can see in adults. because due to the contact to any specific allergens, it can be any commonly like dusty things or any type of food items, or any type of exposure to any pollens or anything. The person typically get this symptoms only when he is having the contact with this type of allergy triggering factors. So here also the lesions may develop in the lower limbs, chest, and also it can be seen on the hands and all. The next one is Stersis dermatitis. Stersis dermatitis means here the lesions appear due to the circulatory defect. So if the circulation is not proper in any arteries or veins, so that time the lesions may appear. It's very commonly seen in feet, especially that is lower limb. And the next one is nummular eczema. Nummular eczema we can see more in men. So here the lesions will be round lesions, round reddy lesions will be there. And the other one is seborrheic dermatitis. Seborrheic dermatitis, here we can see thick, patchy and sometimes scaly lesion on scalp, face and behind the ears and all. Sometimes this lesion appears even in the mid of the chest also. The next type is dyshydrotic eczema. It is one of the another common type which we can see especially on hands more, and even on feet, especially that is on palm, fingers, sole and toes. It will be more itchy, and sometimes pustular small blisters develop on these areas. Some of the common food items people who are facing this condition should avoid is, especially they should avoid seafoods, meat, especially red meat, chicken and deep fried food items, maida products. And if you find that something which you take, you feel that it's allergic to you, try to avoid it. And what all they have to follow is take plenty of water. This is very important. In all my videos I used to say that you must keep yourself hydrated well. So for our skin health, water is very important. So drink plenty of water. According to your weight, you have to drink plenty of water. And also take food that is rich in antioxidants. Actually take more fruits, vegetables. You can avoid certain vegetables like brinjal and tapioca. Some of the underground roots are there, no? You can avoid that. But you can take plenty of carrot, beetroot, spinach, even cabbage. All these vegetables are very essential and good for our skin. And among fruits, you can have almost all the fruits are rich in antioxidants. So you can have all fruits, especially some which is little citric, like berries, and you can have oranges, apple. And if you feel that you are getting some sort of allergy when you take any of these fruits, you can avoid it. Usually these are very commonly used for skin. Okay. And in my clinic, I used to see that some people who are taking groundnuts are getting more itching sensation in this lesion. So this is some of the thing which I observed in my clinic. So I used to tell them to avoid groundnuts. You can have other nuts like almonds, walnut, hazelnut and all. Try to avoid groundnut if you have itching more. And next we come to the Ayurvedic treatments. So see, you have to realize the fact that Ayurveda is best to treat eczema, because here what protocol we follow is that we used to find the reason behind the condition, and we used to eradicate that completely. So eczema is called as Vijarchika in Ayurveda. So this condition is typically treated according to the symptoms and types. So here we are administering the blood purifiers more, especially some of the medicine preparations which we used to give here is Mahatiktakam, Manjishtadikashayam, Padoladiktagam, Padolamuladikashayam. And we used to give, in order to reduce the itching, we used to advise them to wash with Triphala Churnam. Or we used to, after washing, we used to tell them to apply some of the oils, that is tailas, prepared with name Nalpamradikeram, Eladikeram. These all are one of the common oils which we used to advise them to apply externally in order to avoid that thick patchy lesion, and also in order to avoid the itching. but these are not commonly, we can't say you can use this one. So typically, depending upon the type, you have to take the advice of a doctor, Ayurvedic physician, and then you have to use these medicines. And nextly, here in Ayurveda, some of the common procedure which we do in eczema is we used to do Vrinakshalana and Pracharna, scraping of skin, that thick skin we used to scrape it off. And leech therapy is very commonly followed here. It gives a miraculous result. So the patient will be getting a very good result after some sittings of leech therapy. So these are some of the common treatment protocols which we use in eczema. So I think these important points are very useful to you. So try to share to maximum. And if you are watching my channel for first time, please subscribe my channel. And if you have any doubt, just post a comment in the comment box. So definitely I will reply you. And next time we'll come with a new video.